Hi, I'm Dr. Mike Datola, the Director of Clinical Affairs for Sirona, and one of the questions I get asked a lot at my lectures is about the difference in workflow between single-visit dentistry and multiple-visit dentistry. In fact, a lot of times I get this question from dental assistants wondering how this change might affect their particular workflow. So I wanted to spend a minute or two today with you to go over the workflow for single-visit dentistry. In a multiple-visit crown and bridge case, typically the first thing that we do is take a pre-impression for the temporary. Now this can be taken with alginate, although many offices will use polyvinyl siloxane because they want to be able to hold on to that impression in case the patient breaks the temporary or loses the temporary. And of course, this pre-impression, if it's polyvinyl, can cost $15 to $18 depending on what you're doing. But since there is no temporary in the single-visit dentistry workflow, we do not have to take this impression at all. And so really the first step is going to be the dental assistant placing the topical anesthetic. And typically this is a time where someone will go get the doctor and we're letting the topical soak in so that we have it in the mouth for 60 to 90 seconds, and then the doctor enters the room and gives the local anesthetic. Now typically at this point, many dentists will get up and leave after giving the local anesthetic, and as you dental assistants know, it can be difficult finding your doctor again. They could be off in another room, updating their Facebook status. It could be 15 or 20 minutes before they come back in. But in single-visit dentistry, the typical workflow after administering the local anesthesia is to take the digital impression at this time. And so either it's going to be the doctor, or if your state allows it, you can do it as well. And we're going to take the digital impression of the opposing arch. Then we're going to take the digital impression of the arch in which we are doing the preparation. And then we will have the patient close together and we will image the buccal bite portion as well. And so essentially we've taken most of the impression that we need. We got the tooth we're preparing and a couple teeth on either side of that, the same opposing arch, and then the buccal bite together. And when we go to take the digital impression, we're simply going to cut out that tooth we prepared and then rescan it again. Now the nice part about this is we're accomplishing this while the patient is letting the anesthetic start to work, and so as soon as you're done with the digital impression, the dentist can pick up the handpiece and start to work right away. So when it comes to the preparation itself, nothing much changes, and a lot of that is due in part to Cerec Zirconia, our newest material available for chairside CAD/CAM systems. And because it's a solid zirconia crown that we're going to be fabricating, the dentist really has nothing they have to change about their preparation. In fact, they can prepare the tooth much the same way they would prepare a cast gold crown. Now, once dentists get involved with single-visit dentistry, one of the changes you'll notice is that oftentimes they will place their margins in a different place than they used to, since they're the ones actually marking the margin, designing the crown, and fabricating the crown. And as a result, many dentists will now use supragingival margins, which means the gingival margin of the crown is above where the soft tissue margin is, or they use an equigingival margin, where the gingival margin of the tooth preparation is equal to where the soft tissue outline is. And what this means is a lot of single-visit dentists do not have to place retraction cord anymore. And this is one of the things that dental assistants and even dentists really didn't like doing, and it's nice being able to eliminate that as part of this procedure. Many times it's just a diode laser that needs to be used interproximally where some tissue had been irritated, say by an old amalgam or something like that. Once the single prepared tooth has been imaged and then stitched into the overall impression, it's time to mark the margin, design the crown, and again, this can be done by yourself or the doctor. This is the part that a lot of dental assistants actually find fun as they gain experience with the system, is being able to design the permanent crown that's going to become a part of the patient's mouth, and it is a lot of fun. It's certainly something that you may find is exciting for you to be able to do, working with your doctor to help get some really nice designs and then send it to the mill. And in this case, we're going to have a zirconia crown milled out of this block and then run it up in the oven so that it reaches its final strength. And again, this is a big part of the single visit story, is that the patient's not having to come back for this second appointment. We're making the permanent crown on this same day. And a lot of dentists are rediscovering how much they enjoy cementing crowns rather than having to bond them into place. And I know dental assistants love it too because it's difficult to clean adhesive resin cements from in between adjacent teeth. They set quickly and they set hard as a rock, and you're often in there with an explorer or a sickle scaler trying to pry this piece of cement out of there, and it's much easier to do when we're actually cementing crowns, when a simple piece of glide floss with a knot or two in it will take out any remaining cement. And that's it. That's the entire single visit appointment. There's no temporary to make, worried about having nice closed margins, worried about getting the context correct, worry about whether or not the patient's gonna knock off the temporary and need to come back and have it re-cemented. Or even worse, the patient who knocks off the temporary and doesn't come back for 10 days, and now you're trying to seat a permanent crown when you've had all kinds of shifting of teeth. The patients love they don't have to take more time off and come back for a second appointment and get numb again. Or even more challenging, the patient who doesn't want to get numb and you as the dental assistant are still trying to pick off the temporary cement while they flinch. That's a very difficult thing to have to go through. There's no doubt in my mind that single visit dentistry is the best thing for the patient's tooth, and for your office as well. When I got out of dental school 27 years ago, most endodontics was accomplished in multiple appointments. And then because of improved filing with engine-driven files and improved obturation methods, we're now able to routinely do root canals in a single visit, and patients love it. Crown and bridge has been traditionally done in multiple visits because we needed the lab to fabricate a high-strength crown for us for posterior teeth. But Cerec Zirconia changes that today. Ask a couple of patients whether or not they'd like to have their crown done in one appointment or two. But I don't think you need to. I think you know what that answer is going to be. And perhaps most telling, every dentist I know who needed a crown and went to a friend who had a Cerec system and they got a single visit crown, those dentists subsequently ended up bringing that technology into their practice so they could offer it to their patients as well. Sometimes we truly do learn more when we're the patient than when we're the doctor. I want to thank you for your time and your continued commitment to quality dentistry.